North Carolina making a push to address the mental health crisis that touches nearly every corner of the state.
A new state report shows some progress, also reveals just how much there is still left to do. WECT's Mackenzie Bruns, more on what the state is doing to attack the crisis. Now, Mackenzie, you talked with some healthcare providers today. How do they feel about the state's progress so far?
Well, John, the people I spoke to today reacted positively from the improvements from the state, but admit there's still work to be done. The doors at Coastal Horizons in Wilmington are constantly revolving as more and more people seek substance abuse and mental health help. Chief Operating Officer Ryan Estes says that demand isn't slowing down.
Over here in Wilmington, I would say there's about 700 people who come through daily.
The North Carolina Department of Health and Human Services says it's making strides to meet the need. The state just released its first-year progress report on a 5-year plan to overhaul mental health care statewide. And Secretary Dev Sangvi says the state is making strides.
North Carolina now is willing to say, we have a problem, for lack of a better term, and we want to do something about it.
The General Assembly appropriated nearly $1 billion for behavioral health. And in year one, the state opened 7 new urgent care centers, launched mobile opioid treatment programs, and expanded access to care.
Our goal is really to make sure that if someone has a behavioral health need, they're really things we're focused on. We want that individual to have someone to contact, someone to respond, and a safe place for help.
Locally, Coastal Horizons received nearly $1 million, expanding infant mental health services and growing its opioid treatment program to serve nearly 1,000 people in the Tri-County area.
We're really building out a robust infrastructure in this area and across the state to serve people's needs.
But gaps remain. Wilmington still lacks a 24-hour behavioral health urgent care center, and keeping qualified workers and community health is an ongoing struggle.
I know that there are more people that need care than our system could handle years ago, and frankly can probably still handle today, and we're trying to rise to meet that need.
The state says it's working to address both, measuring these programs, all while Estes and his team continues pushing to keep these doors open for everyone who needs them. The state says it plans to continue refining its approach based on data, measuring utilization and long-term impact to make sure money is going where it's needed most. Mackenzie Bruns, WECT News.